station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to the show. It's Dane hanging out with you on Bobo 103.1 FM. Favorite part of the week when we get to speak to people that are very educated and very much smarter than us, right? We're not ashamed to admit that. And this week we have very special guests in the studio, or should I say there's more than one, obviously. There's two guests that's here in the studios with us. There's going to be a third one that's going to be joining us very soon. They're from HSA because this show is dedicated to all things HSA, all right? So we have usually interviewed individuals that have worked in the marketing department. They're doctors, they're admin staff. Maybe they work in a certain department that we have never heard about before. Just recently, I think it was 2 weeks ago, I just found out about the experience team at HSA, and I was very, very much surprised that this team actually exists. And I felt like it was such a wonderful team to implement at the hospital because there's not a person that's not walking around that facility that does not need help or feedback or just a little bit of support. So I like to have these guys in to kind of just introduce themselves and talk about their specialty. The show really does belong to them, guys. So if you have any questions, be okay with sending us a message through our social media at, of course, Bobo 103.1 FM. We'll get the questions over to them at HSA, and they'll be happy to get back to you just in case there may be something that's missed in this interview. Now, I'll have the guests introduce themselves. Here, they're here in the Bobo Studios at the moment, so I'll have them proudly introduce themselves, their title, and what they do currently at HSA. And we start, of course, with ladies. We'll jump into yes.
Hi, my name's Layla Aitken. I'm the paediatric nurse at Georgetown Hospital. Oh, sorry, Anthony Eden Hospital.
Yeah, yes. It's changed now, right?
It has. I keep forgetting.
We still say HSA.
Yeah, okay, HSA.
Because they haven't changed the logo yet.
No, they haven't. We're not changing the logo as far as I'm aware. It's just the title, Georgetown Hospital. I'm rambling on.
Okay, no, it's good.
Sorry.
It's good. It's good. And how long have you been doing that?
I've been there since 2002.
Yeah.
That's my second visit. I was here earlier on.
I recognize you. Where would I have seen you if I came into the hospital?
In the paediatric ward upstairs. However, I did cover A&E, NICU, and ACU if you've been there as well.
Okay, as long as it wasn't the mental ward, then I'm good. We didn't meet in there, right? That's good. All right, and we have a next guest in the studio. Why don't you introduce yourself?
Hi, I'm Pradip Thakker. I'm a paediatrician and paediatric cardiology background, and I've just been with Anthony Eden Hospital for 2 months.
2 months?
2 months. I'm just finding my way around.
Yeah. Where before that?
I was in UK.
Okay.
I've been a consultant in UK for over 25 years.
Any differences you finding right now in the 2 months that you've been here? You can say it. You're allowed to say it.
Is that a trick question?
You know, it's not. We want to understand how our cultures are very much different. So we wanted to know what is the difference that you find here so far compared to your life in the UK. We know it's only been 2 months, but small things.
You know what? This is an amazing island, and I tell people how fabulous the people are on island, and that is the most striking thing here. Everybody has a smile on their face to a large extent, and that is so noticeable. Everybody's so helpful, so friendly. I feel safe. And I can walk around at night time and I don't worry about it. So that's the most important thing for me coming here that I've noticed.
Yeah. So I feel like I know you already, doctor. So what you're telling me at this very moment, you never smiled in the UK. You did not feel safe at some point.
Well, I'm being honest, and we've got 65 million people.
Yeah.
In UK. Yeah. So having said that, with 65 million people, there's still more traffic here than there is in the UK.
Yeah, man, you're telling the wrong person. I live on the other side of the island, north side, past the border. So I know how the traffic can be, especially when school starts back. But we're happy to have you here.
Thank you so much for having me.
I think you're gonna fit in well because of things that you've noticed already about our culture, and we're just happy to have you here, especially because of your specialty, which I want you to do right now. Leads me into my first question. Talk about your specialty and how long you've been doing it, how you got started. You were an open book for the next minute, just giving us your bio.
Thank you for that. So, like I said, I'm a pediatrician. I've been a pediatrician for 25 years now, working in various institutions. First consultant post was in Coventry. Then I moved to West Midlands, Dudley, and then Nottingham for 18 years. And then finally I was in the Isle of Man.
Yeah.
So another island kind of institution there. So I'm used to that, having been working in a small place like that to a major teaching hospital like Nottingham for 18 years. We all start off in our training as in pediatrics. Actually, my training goes back before that. I was in adult cardiology.
Yeah.
So I started off doing adult cardiology for 2 years because we weren't, funny enough, we weren't allowed to go into pediatrics unless you had adult training.
Oh, wow.
Yeah, it was very different in those days. So pediatrics was regarded as a super specialist subject.
Is that only in the UK? Is that for the United States also? It's all around.
Well, no, that was for UK in those days. It's changed now.
Okay.
Nowadays, you can go straight into pediatrics.
Yeah.
As a specialty. But when I was wanting to get into pediatrics, I had to get the postgraduate qualification in adult medicine first.
Oh, wow.
Before I moved into pediatrics. And that's where my interest in cardiology came, because I did a lot of coronary care work in UK. We were sort of at the front line of adults having, cardiac events, cardiac arrhythmias, and working on coronary care unit was exciting. So that's where it started. And then I discovered pediatrics, and I thought, wow, this is amazing. Cardiology is nice, but pediatrics was really, really good, really special. And, so I moved from doing adult medicine. I then went into pediatrics and got into pediatrics at that stage. I actually specialized in neonatology, first and foremost. So I did my training in neonatology, qualified neonatologist, but then my interest took me into cardiology because one of the primary things about being a neonatologist, I'm talking many years ago. I'm not a spring chicken.
Yeah. You still look young, doctor. I'm still seeing a guy in front of me.
So, in those days, we had to think on our feet in terms of physiology because neonatology was, advancing fairly rapidly. And so having an ability to look at the heart as well as the lungs, because premature babies' main problem is the lungs, but actually the lung is explicitly connected to the heart.
Yeah.
So you could measure lung pressures by looking at the heart. And so that gave me an added dimension, having that skill of looking at the heart, which I'd sort of learned over a period of time. And I could do my neonatology in a different way. In those days, we were giving medications that could drop the blood pressure of a baby very rapidly.
Yeah.
And if I did that, then I would be monitoring the heart at the same time. So then I can give that medication in a controlled fashion and so prevent sort of longer term complications. So I did neonatology in a different way. And in those days, I'm talking about 25, 30 years ago, there were very few people doing cardiology and neonatology. I was one of the very few. And then it progressed from doing just neonatal cardiology to stretching out further to looking at children, older children, going right up to 16, 18 years of age. And so my interest grew, as did my experience. And then I sort of stretched out into things like looking at children and teenagers who faint and the physiology behind fainting. And that, again, that's related to the heart. And so I developed the very first syncope service in Nottingham. that because nobody had an interest in pediatric syncope. Syncope means fainting or fits, faints, and funny turns, whatever you want to call it.
Yeah.
So I used to get referrals from all over the country with children who used to have complex fainting or funny turns, or it could be epilepsy, it could be cardiac, could be arrhythmias, could be all sorts of very sort of autonomic function problems. And so my experience grew in that area, again, related to cardiac interest. So the cardiology has really helped me along the way, starting right from the neonatal period all the way to looking at teenagers who have funny fainting episodes.
Yeah.
And then I sort of was getting referrals for teenagers who were playing high-level sports. And in UK, one of the problems is that adult cardiologists never used to see anybody under 16 years of age because they're not licensed. It's against GMC regulation for them to see anybody under 16 years of age.
Oh, wow.
So anybody who is playing high-level sports in a big institution like Nottingham, which is second largest teaching hospital in the country, I was getting a lot of teenagers whose parents wanted them screened because they were playing club football or club, volleyball, basketball, whatever.
And around what time was that? What would you say? What year was that?
So this was, I'm probably about, I started screening, well, I've been working in Nottingham since 2005.
Yeah.
And so I was getting teenagers referred to me throughout.
Around that time?
Screen them, yeah.
Because I know the reason I asked that question is because I know this is a huge concern amongst parents now, especially because of, I don't know if you guys have saw the report on it with LeBron James.
Yes.
And his son, Bronny, who actually passed out during practice. And we still don't know exactly what happened there, but apparently it was for a heart condition. We know that he's back in intense sports and elite sports playing in the NBA, actually. Yeah. But I think a lot of parents took notice to this because it became a huge concern now. Are we really checking our kids out? Do we know what's happening? This is an issue that no parent wants to deal with, right?
Yeah. So in Europe and America, I'm fairly certain that there is screening going on for children who are playing club and high level sports. It's just coming into UK. In UK, there's an organisation called CRY, Cardiac Risk in the Young, and they have a touring team that goes around screening children in schools. But you can volunteer to have your child screened. It's not mandatory.
Yeah.
It's not a must that you have to do that. But most parents prefer to have their child have a cardiac screen, particularly if they're playing high level sports. And so that was, a part of my work, it's an extension of the cardiac work that I did, as well as screening for congenital heart disease. I also had a lot of children referred to me because somebody died suddenly under the age of 40, called sudden adult death syndrome, or, whether it's an uncle, an aunt, or, parents, they would screen their children for that reason because of cardiac genetic problems. So that was another part of the work that I did, and I developed a lot of interest in seeing children with early pickup of inherited congenital cardiac problems that can lead to arrhythmogenic complications.
Yeah. Now, listen, you spoke a very wide detail on your specialty. What I want to get into, just really quick, because I saw the passion in your eyes when you said you decided that this was going to be your specialty that you switched to. Why did you had that passion? What was it about this specialty that you said to yourself, no, this is what I want to do. This has piqued my interest? Because I saw the passion, but you never really took us on what led you there. Because I'm intrigued now, and I'm pretty sure the listeners are too.
Yeah, so it really started off from the adult cardiology world to pediatrics. But then I thought, actually, my interest is not just hearts. I'm a pediatrician first and foremost.
Yeah.
And so I could offer a holistic approach. This holistic approach to, somebody comes in with a cardiac-related concern, chest pain, for instance. Well, actually, chest pain is not necessarily the heart. Common things are common. It could be musculoskeletal. They just need reassurance. It could be asthma-related chest pain.
Yeah.
It could be gastroesophageal reflux-related chest pain. There are many things. So having that wider knowledge of pediatrics, as well as having the cardiac background, makes me more of a holistic person, and I can address the concerns of the families, and offer more reassurance and more guidance.
I love that. Doctor, why did you decide that this is what you wanted to do? When did you decide that you wanted to be a doctor? At what age did you say, and why?
Being a doctor, oh gosh.
It's always like, I feel like it's a crazy field to explore. And I'll tell you why, because my daughter wants to do it. Okay. And it feels like she's spending her whole life in it. So what made you, she's giving me her answer. And it's it always seems the same when I ask every doctor. So I want to find out from you.
So, you know what? Being a doctor is a sense of pride for parents, and I'm talking about 20, 30 years ago, when parents wanted their children to have a career, they would either say solicitor, a doctor, an accountant.
Yeah.
It's a common thing. They're common,
yeah. But a doctor is rated number one.
Number one.
If you've noticed that,
right? It used
Yes.
to be. No longer the case.
What do you think is now?
No longer the case. I think working in the city, in the big market.
Yeah, stock exchange.
Financial.
Yeah.
or
crypto.
Or even
so
playing high-level sports.
Or influencer.
Yeah. Or an influencer, a blogger, yeah.
One of those.
So, so in the old days, it was like, you do one or the others. But my interest came because I've come from a very humble background. Mm. And I wanted to give back to society in different ways that I could. And I've done lots of voluntary and missionary work along the way.
Love that.
So,
yeah, I love that, man. I wanted to know what piqued your interest, because it's always funny. Like, every doctor that's come in here and we've had interviews with them, they've all said, I love serving people. Like, I love to help people. Some have a background of, I lost my grandpa to a heart attack, so I wanted to be able to save somebody next time. So there's always a different story or a passion that was the reason that they were driven towards that purpose, right? So I always like to hear the story behind the man or the woman that's talking behind the mic. I think one of the things I want to ask you before we get into your next question, because this is the first time that this is a specialty for HSA, and I want to talk about that and just how big that is for HSA. But also, what would you say? And this is, I think, for both of you that's here in the studio. What would you say to your 18-year-old self now? Like, where you are today, what would you go back and say to your 18-year-old self?
I would never imagine myself here sitting talking to you, to be honest. I went to one of the roughest schools in East Anglia.
Wow.
And I was one of the very few 3 or 4 students who got any qualification. Yeah. So I would say to all my patients, and I encourage the teenagers particularly, nothing is ever lost.
Yeah.
If you take my example, you can succeed.
Yeah.
So don't ever give up. Even if they're recovering from a chronic disease or a cancer, they've had downtime. These patients I used to see with syncope, with fainting, funny turns, chronic fatigue. I always say to them, you may have lost a year or 2, but it's not a rat race. Get up on your feet and you can succeed and you can get to where you want to, because I've done it.
So I'm guessing that everybody feels that they know you're ready for this interview. We're done. We're I don't know if we have anything else to ask you. We do have a lot of stuff, but that was good. I like that. Of course, I do not want to leave you out of this.
Oh, no.
I didn't want to leave you because I know you've been at the HSA for a very long time. And if you can imagine your 18-year-old self, what would you say to her?
I don't know. Carry on, one step at a time, and don't have any regrets. Don't look back. Always move forward.
Yeah, I love the part with no regrets.
Oh yeah, no regrets, and move forward.
Yeah, I love that. And the one step at a time too. That's good. Guys, we're going to take a quick break. That leads us into our break really quick, and we're going to come back. We're going to find out just how important and groundbreaking this specialty is to HSA, and we'll talk more to these incredible doctors in the studios and nurses. So when we come back, keep it locked. It's Bobo 103.1.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI-accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
All right, welcome back to Bobo 103.1 FM. It's Dane hanging out with you here. Thank you so much for tuning in. This is a special show dedicated to all things HSA. We jump into deep conversations with the doctors of HSA, admin staff, marketing support, and beyond. Maybe there's a conference that's coming up and we need to let you know what the conference is about, educate you a little bit. It's all things HSA. If you have any questions, do not be afraid or hesitate at all to message us on our social media at Bobo 103.1, and you can reach out to us. We will then pass on those questions to the doctors, nurses, the admin staff, anybody that comes on, and they will proudly answer it for you. They'll get back in touch with us or directly to you. All right, so we'll have our guests introduce themselves. Again, we usually do this for the new listenerships, anybody that's just joining us for the first time. So just introduce yourself the same order you did before, and just, your background and your specialty in a summarized version. And we'll start, of course, with ladies first before we jump back into our interview.
Hi, my name's Layla Aitken. I'm a paediatric nurse at Anthony Eden Hospital, HSA.
Love it.
Hi, I'm Pradip Thakker. I'm a paediatrician at Anthony Eden Hospital and also specializing in pediatric cardiology.
Now that specialty right there, it's new to HSA, isn't it? It's the first time ever that HSA has this specialty. And how big is this for the hospital?
HSA have been providing cardiac screening for children, but it's for me it's different because I'm a pediatrician.
Yeah,
providing that service. I don't have any adult cardiology background per se, so I'm very much focused on the pediatric cardiology side, whereas prior to that, my colleague has been providing pediatric cardiac support in terms of offering some screening. So to be fair, there has been some service at HSA, and I'm just enhancing that service.
And that leads me to the next one, doctor, because you talk about the enhancement, but you said you were a pediatrician first, obviously, but this new specialty, right? What's the difference? What is the difference between both of them?
Well, for me, it's with my training in neonatology, pediatrics, pediatric cardiology, it's offering very much a holistic approach to families and the child. So, you could come into my clinic with a specific problem of having a cardiac-related issue, but I would explore that even more to much wider pediatric-related issues like, for instance, looking at the growth chart or looking at, how tall you are, how hard, how big you are, any other related conditions, any other associated symptoms. So there'd be much more exploration from my perspective. It wouldn't be just focused on the problem you've come to me, because for me, a problem doesn't always signify one diagnosis. It could be, a differential of many things, pediatric related. And I think that's a difference.
That's a good way to break it down. But I think one of the ways you can say all these fancy terminologies to me all day, every day, but I love examples, right? And I know you've only been here for 2 months, so I don't think there's anything that you've done here right now at the very moment. You're still trying to, work your way around here on the island and the hospital. But in your previous workplace, maybe you can tell us give us an example on how your dual, of course, responsibilities now at the hospital has significantly helped somebody in the past. Maybe an experience, maybe something that's happened before.
Well, I can just give you an example of I started my first cardiology clinic just 2 days ago. And I can give you an example of how I would deal with a patient I saw. It was a child with Down syndrome.
Yeah.
And we screen all children with Down syndrome or congenital heart disease. Even if the antenatal scan was normal, the antenatal pickup for congenital heart disease is around 60% in good operators' hands. So even if the scan was normal, we will still have to screen. And there's a screening program for Down syndrome going forward.
Yeah.
But it's not just about the heart. It's about the child's growth, whether the child's developing any other related issues like jaundice, feeding, the floppiness, managing the floppiness and having multi-professional involvement. So although it was a cardiac emphasis, but it was also looking at all the other relevant factors related to that particular child. And I think that's what makes the difference of having a pediatric background.
Yeah. Any patient stands out to you from the UK that you will carry with you for the rest of your life? Like, I know that you meet people before, like, in different fields, which we were talking about off the air. But a police officer would say, I remember this time I went into this crime scene, and I'll never forget, just what I saw or who I helped. And I still see that child till today. Or a fireman that says, I ended up saving this young lady. And up to today, she still comes at this time every year to drop me off cookies or cakes. Is there a patient that stands out to you in the UK or anywhere that you have visited or you've seen, and you said to yourself, because of what I did, that significantly improved the life of that person?
Yeah, there are many examples, but I'll give you one or two examples. I had an email just about 10 days ago, which was really surprising, from UK.
Yeah.
The patient's parents had tracked me down and found me and found my email address and sent a lovely email. It was a child I was following up on the Isle of Man, where I worked previously, and came in with fleshy nodules on the skin all over. And actually they'd come for a different reason, but I picked up the child had fleshy nodules. And those fleshy nodules was a rare diagnosis in a 2-year-old of chronic granulomatous kind of condition. But also the child also had a cardiac murmur. So in that same clinic, I picked up the murmur, then I brought them into my cardiac clinic, and then we diagnosed a very rare congenital heart problem that connects the artery, the coronary arteries to the pulmonary artery.
Yeah.
It's called Al Kappa. So this was a big diagnosis to have picked up, as well as the chronic granulomatous kind of condition. And so Mum sent me this lovely email to say that, if we hadn't come to your clinic, we wouldn't have had the skin condition diagnosed, nor would we have the cardiac condition diagnosed. So that was really wonderful email that she tracked me down and actually sent me that email. And there are teenagers who have sent me wonderful cards at Christmas time.
Yeah.
And these teenagers have come to me having been on a journey of trying to find out why they've been feeling particularly chronically fatigued, missing out on school, friendships, social sort of activities, and they've been sort of to various pediatric clinics trying to identify why they've got chronic fatigue problems. And we used to do something called complex syncope testing in Nottingham, and we would look at why the children were getting fatigued and having sort of near fainting type episodes, and we would look at the physiology of this. And that physiology we would then show to the parent and the children and explain to them why their body was feeling the way it was. And then we would use medication, which a lot of the time were off-license medications, to try and help them improve their autonomic control, their blood pressure, heart rate control. We used to have really good success. And so when somebody who comes in a wheelchair to your clinic with so much fatigue and tiredness that they can't even stand physically, to then coming back, walking into your clinic, it's just fabulous to see.
Yeah.
You've transformed a teenager's life, because that teenager will then go on to succeed.
Yeah.
So there are many examples like this.
You're giving these students and kids a future. That's what you're doing in your career, and I like that. That's what I'm gathering from this interview right now. And I want to ask you a question, and you are allowed to say no comment on this one, right? But please feel inclined to, because I know who you work for at the end of the day. So we don't want to get you in trouble with your job in the first 2 months. But the reason I want to ask this question is because you mentioned something that was a great takeaway. You said these students were going to different doctors, and nobody could figure out what was wrong with them. That is the fear today, I think, with a lot of people. It used to be that, you'd break it down and you would put men in this category and women in this category, or depending on their culture, you would say, well, African-American men don't like to go to the doctors and get checked up. It's just a thing. But now you hear more conversations of people saying, well, I don't know if the doctor really knows what's wrong with me. So why should I go? Or they don't know who to go to or who to trust. And there's a medical center popping up everywhere. And everywhere you look, you can throw a quarter and find a medical center. And you're saying to yourself, who do I trust? Why do you think that is that people are having more and more trouble to identify what's wrong with them? Because this is one of those questions that, you could answer in such a way where it has nothing to do with HSA, but maybe just your expertise and why does it feel that way to people walking into doctors and say, I don't know if he really understands what's wrong with me?
It comes down to experience. So when I was setting up the syncope service of fits, faints, and funny turn service, once we were established, people got to know what kind of patients we would want to see. And we were getting referrals all the way from Scotland to London to East and West, all over, because, people were stuck. And it's good to say, I don't know.
Yeah.
It's really honest to say to the patients and the parents,
I like that.
I'm really not sure what's going on, but I do know somebody who does. And it's that collaboration. You're working for the patient.
Yeah.
It's all about the patient. And as long as you have that focus, you can say, I don't know, but I will try and find out somebody who possibly does. And so you find the best person who's got an expertise. I don't claim to know everything.
Yeah.
I'm not an expert in everything. So if I don't know certain areas in medicine, I would look for somebody that would help that patient, rather than trying to fumble my way through.
Yeah.
I'd rather somebody who's better than me look at that patient and try and get to the bottom and start treating appropriately. And I think it works more so from my experience in UK. I'm still learning about what happens here on the island, but I'm hoping that when people realize there are individuals on the island with different expertise, we can share that expertise and guide the patient's journey.
Yeah. I really love your response on that one. It's okay to say, I don't know. I think patients wants to hear that. They want to hear that also, right? Just that way they can continue to realize, okay, well, look, you identified that you don't know, but you possibly think that something might be wrong. And there's other people, experts in the field that you would recommend. But obviously we see now more and more that it's more of a competition these days. And I don't think a patient wants anything to do with the competition. It's more like working in sync and collaboration, right? Which leads me to my next question. How are you going to collaborate with the departments in HSA? How do you plan to, obviously this is new to you, but how does this benefit other departments of HSA?
So look, everything is about teamwork. No individual can say, I'm the only person who can do this. You need a team. So I need to have my nursing colleagues. I need to have my cardiac physiology colleagues. I need to have my consultant colleagues who also support me, because there'll be times when I'm not going to be here.
Yeah. Yeah.
It should never be a single person service, because that person may go off on sick leave and maybe on holiday for 3-4 weeks. And, so that you need your colleagues to support you whilst you're away. So it's a departmental collaboration, and hopefully I can help various different departments. So when I was working in a big teaching hospital, for instance, I was helping the oncologists screen their children who've had cardiotoxic drugs. So I would do the scans for them. I would help nephrologists, kids with hypertensive crisis. They would need cardiac involvement. I would help the gastroenterologists, because their children used to have total parental nutrition and central lines that may get infected. So they would need a cardiology input from there.
Yeah.
I would help the neurologist. So you'd help all the different departments, because the heart is important in all the organs. Yeah. So if there is a situation where somebody needs the heart to be looked at, I'll be there to help support them. So it is collaboration.
Yeah. Collaboration is definitely important, and I'm glad that you mentioned that. And with 2 months in, I'm finding already that people are going to get along very well working with you. We're going to come back very soon and continue the interview. We're going to take a quick commercial break. But when we come back, we do have our nurse here that we're going to ask some questions. She's been silent. We're going to finally get her to talk, and it's not going to be for a very long conversation. She's not much of a talker, but she has a lot of expertise, and she usually just do her job, right? But she's here to kind of just give you a little bit of a background of what she's done for the hospital. Anthony Eden Hospital now but we still refer to it as HSA. So when we come back, keep it locked. We'll have more on, of course, Nurse Layla.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
All right, welcome to Bobo 103.1 FM. Dane is here hanging out with you, and of course, covering, of course, a very special interview, which we do on a weekly basis here with HSA. And we talk all things, of course, the specialties that each doctor has contributed here at HSA, or we call it now the Anthony Eden Hospital. And also, we speak to admin staff. We speak about events, just different things that takes place at the Anthony Eden Hospital. And I have two very special guests here in the studios. I've had them introduce themselves. I know it becomes a little bit tedious when they have to keep doing it, but obviously we got new listeners that are just joining us, so we want to make sure you guys know exactly who's speaking through the airwaves. So we'll start again, same order. Have them introduce themselves and what their specialty is at HSA, aka the Anthony Eden Hospital.
Hi, my name's Layla Aitken. I'm a paediatric nurse at Anthony Eden Hospital.
Hi, I'm Pradip Thakker. I'm a paediatrician with a particular interest in paediatric cardiology.
Love it. I've been having a wonderful conversation with both of these individuals, but now we jump into Nurse Layla, which you have been, once again, you've been over 10 years, right, at the hospital? How long has it been in total?
23 years, I think.
23 years. Oh, my goodness. You've seen a lot.
Yes, a lot of changes.
A wealth of knowledge. And she's not going to speak long on this. She's going to give you a summarized version of just what her day looks like at Anthony Eden Hospital.
Well, currently I'm in the outpatient clinic, in the paediatric outpatient clinic. First thing in the morning, we do our safety checks, check all the rooms are set up for the specialities. Obviously, now with Dr. Thakker, the echo machine is brought down, and so is the ECG machine. So we can do everything in one place rather than them going off to different departments. But we also have other specialities there as well, pediatric specialities. We do developmental checks.
Yeah.
We do pediatric genetics, and we've had, recently we've had a neonatologist, so we now do premature baby checks as well. And we also do sick visit. We do an acute clinic as well.
Amazing. I love that. I'm going to pull your leg one more time. Just let's kind of pull you back into the mic. I'm sorry. But what made you, because obviously you've been there 23 years now, so you obviously enjoy your job, right?
Yes.
All right. So I want to ask you the same question I asked the doctor earlier. Is there one thing that stands out to you with a patient that you still remember up to today? Because 23 years is a long time.
Yeah, there are a few. There are people, actually, when you go to Foster's,
Yeah.
Perks and Hurley's, I'll say all three.
Yeah.
They come up and say thank you, and they remember me. I may not remember the child because obviously they've grown.
It's a lot too.
Yeah. And some of the children have now had children. So I'm a grandparent.
Oh, wow. So good.
In inverted brackets.
Yeah, that's so good, man.
No, there are a few. Some of them are heartbreaking as well.
Yeah.
So, yeah.
That's good, man. At least you have so much memories in there, and I can tell that you love your job. So appreciate you being on the radio today and to give your brief summary of your story that's still continuing. All right, doctor, we're going to jump right back into, I think, a very important question that I wanted to ask. And this is one for all parents that I think this possibly right now going through this or about to possibly hear this message in the future, and what support systems are in place for families after they hear that their beautiful child, has a heart condition.
So now we have an ability to see children at HSA. We have had that ability, but even more of an ability now.
Yeah.
And I've started my clinics on a Tuesday morning. So I'm happy to take referrals to my clinic with any parent who's concerned about their child's heart, be it chest pain or whether the child's having palpitations or fainting or family history of congenital heart problems, or mom or dad have got heart problems, anything really, I'm happy to have a look in my clinic and offer guidance.
Well, that's one of the things that's in place. You are obviously there, so they can obviously have your expertise involved. But I think one of the things that I think we need to all obviously educate parents on today that's listening, what are the signs? Like, what should they be looking out for any child that has a heart condition?
Okay, so it depends on the age of the child. In the sort of infancy range of that child, the things that they should be looking out for are things like poor feeding, getting breathless, breathing fast, or being a bit quiet, not gaining weight adequately. So if the child is displaying any of these signs, first and foremost, they have to think about infection. We have to rule that out.
Why not to cut you off too, but why quiet?
Quiet, because if they have a very fast underlying arrhythmia, one of the things that we say to parents is that the babies go quiet. They have like an apprehensive quietness.
Mm-hmm.
So if the babies can have arrhythmias, it's not uncommon. If they've got an underlying structural problem, they're more likely to have difficulty with feeding, being more breathless, and not gaining adequate weight. So those kind of things. If it was an older child, they may have recurrent infections. They keep coming in with chest infections. They may not be able to keep up with peers. They're getting breathless when they're exercising. So depending on the age range, they can present in different ways.
What about like if a child is feeling like weird compressions in their chest? Like they feel like every time they're about to work out, like I'll give you an example. And this is not a child, but obviously it's an adult that works here. Recently he was working out, taking care of his health. Obviously he's at that age that he wants to make sure he's always consistently going to the gym and just lifting weights now. And he started to feel like this weird pressure in his chest. So automatically you feel like, I'm at that age. Let me go to the hospital. Let me get checked out. And I don't know exactly what the doctor was saying. They were basically saying because of the workouts that he was doing, it was impacting his chest. All right. So there's a lot of, I bring this up because there's a lot of students that are working there. It's mandatory that they have to go to the gym. So how do you tell the difference that you are possibly going to maybe working out the wrong way, or maybe this is something that's happening with your chest because of the certain workout that you're doing, or no, you need to stop. You probably have an heart issue and you need to see a doctor.
Yes.
How can you tell the difference?
So history is important. If having chest pains at rest in children particularly, it's very unlikely to be cardiac in origin. Common things are common. Musculoskeletal pains are very common. And again, that's down to how much sports they play, what they're doing in terms of at the gym, whether they're lifting weights and things like that. So anything that's happening, particularly at rest, is because children don't get coronary artery problems.
Yeah.
Okay, that's something that they develop later on in life according to their lifestyle. If they are getting exercise-related chest pains, that is something they need to check out. If there is a family history of sudden cardiac deaths or cardiac events where somebody's just collapsed, and there's a family history of this, then they should get help and seek assistance. If there's a family member who's had unexplained rhythm problems and they've ended up with pacemakers or defibrillators, then there's an underlying genetic problem. So it all depends on the history.
Yeah. And early screening, that leads us to our next question. Do you think that's very important to just get the kids in as early as possible to screen them regardless? If you may think, okay, well, you're working out, you're playing more sports, just be something that's common. Should you recommend early screening? Do you recommend that?
Yeah, so I think if we're trying to go in line with Europe or America, that's where things are headed in terms of screening. It's a peace of mind, particularly if a child is playing. I'm not talking about just normal kicking around the football in the field, but particularly if they're competing. It's the competitive nature of the sports. That's where you push your heart to the limit. In those situations, if the parents want to get their child screened, then that's not something unreasonable. But like I said, this is something that's done in Europe and in America.
Yeah, it's mandatory in some places, right?
Yeah.
Some areas. Do you think that's something that we should do here? Do you think that we should be going into schools and screening students, or is there plans to expand with the HSA to do that in schools, especially when there's government-owned schools, right?
Yeah, like I said, I'm open to having referrals for anybody who wants a child screened. In terms of whether it should be mandatory, it's a different healthcare system here because it's insurance-based. And I'm not sure what the logistics of having it, anything that's mandatory on island, I'm not sure how that works really.
Yeah, but is it, and I can say this, I think you're definitely allowed to say this, is it in your opinion that you think that we should kind of make this similar to what it is in the UK and the United States, that it is mandatory?
I think so. If we're aiming to improve healthcare of children on the island and be in par with what other people are doing, then that's where we should be heading, yes.
Yeah, because it's important. I mean, obviously, we spoke about this off air, and we're allowed to have our own opinions on this. But as the sport and community is growing here, I think we also need to think about how we can help the sport and community to be successful. Nobody wants to see a youngster on the field collapse when that could have been avoided by a simple mandatory check before they take on that sport and activity, especially. And if we're not going to go as far as making it mandatory for schools, and let me know if I'm right or wrong, at least make it mandatory if you're in a national team that you have to get checked up.
Yeah,
or get screened.
I think so, yeah. I mean, certainly from my experience, when children were training for Team GB, they used to come to me to see me in Nottingham for screening as part of their workup to go into the Olympics or Commonwealth Games or whatever. Certainly teenagers used to come to me for screening, particularly at high level. But, a lot of the parents have anxiety, particularly when they hear things in the media about their superstars collapsing on the field.
Yeah.
And that leads to alarm bells for a lot of parents who are seeing their children play day in, day out, high-level sports, and they just want their kids screened.
Yeah, I love that. Yeah, it is important to get it screened. I believe in it, and hopefully it's something. I know that the Anthony Eden Hospital and HSA is very big on early. What is it? I'm trying to say. Sorry, guys.
Prevention.
Just make sure it's prevented from the start, right? But what I want to ask right now is, obviously, Nurse Layla, we were trying to keep you off of the radio as much as possible, but we do have to ask this question: is how has it been for the team so far working with a doctor?
Very exciting, actually. We've enjoyed it. We've learnt new skills, old skills that we've relearnt. Haven't done an ECG in 5 years.
Yeah.
So, and then obviously starting to read them as well, to recognise an abnormal one from a normal one. Because the rhythms are slightly different. So, it's been exciting. It's
been good.
It's been challenging.
That's a good thing.
Yeah.
It's always good. I always tell my kids, if it's uncomfortable, it's a good thing. And if it's challenge involved, then you're heading somewhere. All right. Doctor, I want to ask you this. What is your goals like for the next? What does it look like? You've been here 2 months. But where do you hope that this department, this specialty, will look like in the next year?
So, look, I've come into a really good department. I've got fabulous colleagues. Colleagues all around, from consultant colleagues, nursing colleagues, allied health professionals. The management have been really, really supportive. So I'm very pleased with where I've ended up with the HSA. My aim really when I came to this island is just to share my experience and improve the healthcare where I can.
Yeah.
I'm not in any way going to change things that people feel uncomfortable with, but certainly where areas of improvement need to happen, then, I've got the experience to do that.
Yeah.
And as long as people want to have my experience and wanting to change things for the better, I'm there to support it.
I love that. Absolutely love that. Is there any opportunities, guys? I always like to ask this question. Is there any opportunities right now for anyone that has heard this interview and said, I love that area. I love that specialty. I want to get involved. I know Nurse Layla did not speak much, but there's always, obviously, there's an area where you can support like Nurse Layla is doing currently right now? And is there any opportunities for nursing or anybody that wants to get into the specialty with HSA?
Yeah. Well, definitely. If it's teenagers, they do have a program, a school program, and I think that's through Marcia, the training unit. But obviously, colleagues, if they want to come and join us, I'm sure we're quite happy. The HSA will be quite happy to have them on board to come and shadow and have a look and to see what we're doing.
Absolutely. Thank you so much, Nurse Lee. I promise this is the last time I'll ask you to have any
to share knowledge at the HSA.
Yeah, it's important because we do have a lot of students that do listen and they've messaged us before and asked us
we learn from them as well as them learning from us. So it works out both ways.
Absolutely. But before I take the mic from you, like for the student that is saying, yeah, that's exactly what I want to get into. I do want to be a nurse. How would you push them into this area, especially working with HSA?
They do a summer internship program, and that again, I think that's through the HR department.
Yeah.
Somebody can correct me if I'm wrong. And you need to contact them. I think there's an application form that needs to be completed.
Yeah.
And then they're more than welcome to shadow in an area they would like to shadow. And
you are right. You are right. I don't have to correct you. You are absolutely right on that. Shows your years in the hospital there that you are knowledgeable. You do go through the HR department. There is an application form that you have to fill out, and you are interviewed. And it is a prestige program because it's not everybody that gets in. It's a limited space. So if you want to sign up, I don't even know if it's too late now, but still find out. We're going to give the numbers very soon so you can find out that way. But you do have to contact if you have any interest, especially even if you want to be a doctor. If you want to shadow one of these doctors too, you can. They put you in certain departments depending on the area of expertise that you eventually want to get into, right? And finally, for any parent that's listening today, has any concern about their child's heart health or general development, what should they do, doctor? Or nurse, whichever one wants to answer this one.
If there are any concerns from a heart perspective, please do get yourselves referred. Like I said, we run a clinic now once a week at the HSA, and we're open to referrals. We have a running service now where I can offer a one-stop service, so it's not a situation where you'll come in for a consultation, then have to come back for investigations. It'll be a complete one-stop service.
Oh, wow, okay.
And that's a difference.
That's good. And the number that they can use to contact you?
So there are two ways. There's the referrals office if a doctor wants to refer from externally, and that's the usual overseas referral service, and they're aware that we've set up the service.
Yeah.
And then we have a direct line, which is 949-8600, which is straight to the hospital, and they ask for the paediatric clinic.
Okay, amazing. Social media, guys, you literally just search HSA on Instagram and Facebook, and you'll find it. You have it also, do you?
Yeah, one more thing. We do have the website for the HSA.
Okay.
It's
please give us that.
www.hsa.ky. We do have the paediatric department set up on that page. However, we haven't got around to doing Dr. Thakker's cardiology. This just was set up last week.
Yeah, so I'm sure he's forgiven about that. It's been 2 months. So he's good.
Hopefully the marketing department will be organising that. Mm-hmm.
Amazing. All right. And listen, any one of this information that you still need, if you never was able to catch it, please reach out to us at Bobo 103.1 and we'll be happy to give you that information. Doctors, any final words before we end the interview that you'd like to give to our listeners?
Let's go forward and improve the healthcare of the children on the island. That's what we should all be aiming for.
Well said, and a great way to end the interview. Thank you so much, guys.
Thank you. Thank you.